Welcome everybody to the All About the Girls podcast. This month we are featuring Dr. Stella Kyung, a cardiologist from Northwest Health. We got into all types of cardiology advice, how to keep healthy, some differences in the cardiology world between men and women and what we can look for there. And she also gave us plenty of fun info about her history, her career, her family life, and how she manages to do it all. So let's dive right in. Welcome Stella Kyung, cardiologist at Northwest Health. Welcome, Dr. Stella Kyung. How are you today? Thanks for joining us.
Well, thank you for having me. I'm doing very well.
Good. And for those that don't know you, you are, I said very loudly, doctor. I love it. You are a cardiologist with Northwest Health, correct?
Yes, I am.
So tell us a little bit about, for us that don't know what that entails in an average day, tell us a little bit about your career.
Sure. As a cardiologist, I treat people who have any sort of heart conditions, and I often see people who have any concerns or anything that may be related to the heart, any sort of symptoms such as chest pain, difficulty breathing, any fluttering or palpitations, a whole spectrum of different sort of symptoms, and then oftentimes I see them and make sure there's nothing major going on with the heart. And if there is, then we start therapy, any sort of management, further workup.
Okay, that's fantastic. And how often in that world, it's probably pretty serious stuff, right? I mean, this is the heart. This is the kind of the whole thing that runs your body.
Yeah, so
pretty serious industry.
It can be a very serious industry. There's a whole spectrum of different heart diseases, and there could be what we're most familiar with are heart attacks.
Yeah.
That
you hear a cardiologist like, that's the heart attack, doctor.
Yes.
Like, it's not just heart, it's a heart attack.
Yeah, and it's really important to be aware of that. And but since we're on a women-focused show, for women, it's important to know that when you have a heart attack, you may not necessarily have the same symptoms as a man would.
I didn't know that.
So while the classic symptoms are having chest pain right here underneath the breast, worse with exertion, better when you're resting yourself. You might have some sweats, difficulty breathing. It might radiate to the arm, to the back. But for women, you may not be physically exerting yourself. You might just be emotionally stressed out. And emotional stress can have similar physiological effects as you would when you are exercising. Your blood pressure goes up. You might have some palpitations, or your heart rate goes up. So it's important to not just ignore these symptoms and keep moving on. And then the other thing is women might also just have some shortness of breath, or may not necessarily have that crushing chest pain sensation where you're clutching your chest, as you may see on television, Grey's Anatomy. Yeah.
You're like, listen, get it right, guys.
Yeah, but in terms of heart disease, there's also any sort of electrical rhythm problems of the heart. Problems that people may be born with. So there's a big spectrum. So, and oftentimes because the heart is related to the lungs, a lot of people can have similar symptoms, and it's important to have the proper workup done to really evaluate what you're having.
Gosh, that's very intense work. And so I think you're exactly right. Great advice to anybody listening, and great to know all of those things along with your heart health. And for you as a doctor, what would you say, do you have any tips for women on kind of getting to maybe a better place with their health if they're having some difficulties now?
Sure. First and foremost is to, make sure you have a primary care doctor. Talk to them about it. They may be able to order some initial testing, like an electrocardiogram, an echocardiogram, or any sort of, sorry, I'm blinking, but yeah, they'll do the initial testing, and then afterwards, and they may send you to a cardiologist, or they might just send you to see a cardiologist just from the get-go. And I see a whole spectrum of patients' ages, starting with the age 19, maybe 18 is my youngest patient, because that's when you're technically an adult. Right. And then up to my oldest female patient, I believe, is 97. So whole spectrum, and even if you're just having any sort of palpitations and you're in college and you think you're doing okay, chances are most likely you're doing okay, but it's always a good idea to get it further evaluated. If it's, if it's not going away, if it's been progressively worsening, let's just take a look. And then worst case scenario, everything comes back normal.
Yeah, exactly.
Yeah.
Like, hey, we did all that testing and you're good.
Yeah.
And that's at least kind of peace of mind in at least one area.
Exactly.
So let's talk a little bit about you. So you're already giving us all this wonderful advice. I appreciate it a ton. So obviously we all know becoming a doctor is a lot of school and a lot of work and a lot of energy and effort. What brought you to becoming a cardiologist? And tell us a little bit about that journey.
Sure. To start off, I went to medical school because I went to what's called a combined degree program. It's a program that you apply to when you're graduating high school. And there's a few programs out there around the United States. And when you're accepted to both college and to medical school. So that's how my medical school career began. I went to Union College, and then I went to Albany Medical College. And then I found that I liked literally everything that I came across, and I went into internal medicine initially because that's really where the breadth and the depth of most of medicine is. And
you get to do all kind of across the board, every wide range of stuff.
Yeah, but once I started my residency training out in Long Island in Stony Brook, New York, I just fell in love with cardiology, dealing with the matters of the heart. And not only is there a big diversity in the sort of cases that you can see, but as a cardiologist, you are also actively involved in the management, but also the workup. So what that means for me is we do the testing, we do the electrocardiograms, we did the echocardiograms, and for me, I also do heart CT scans, I do heart MRIs. So that for me was very special to be able to be even more involved in a patient's care.
You're really hands-on through the whole thing.
Right. And in general, for cardiology, you can choose to be an interventional cardiologist or an electrophysiologist. What that means is they'll do the procedures to open up your arteries or to fix your valve or to help fix the electrical problems that you may be having. So having that hands-on opportunity was very special to me.
Sounds right up your alley. Exactly what you were looking for.
It was.
And how long have you been a doctor?
So technically, once you graduate medical school, you're a doctor. So 8 years, I would say.
Okay, great. That's amazing. And tell me one of your big lessons learned through that journey, whether it's to become a cardiologist or after you became a cardiologist. Was there anything that kind of slapped you in the face that just surprised the heck out of you about the industry or getting to that point?
Oh, absolutely. One of the things was just how much, well, I guess it shouldn't have been surprising, but
sometimes things surprise us. That's okay.
Yeah, but it was just maybe I was naive going into medical school, maybe a little too full of myself. But once I was in it, it was really eye-opening, and I was very appreciative of what a team-based approach everything is. Because you may come to see me, just a cardiologist, and then every decision that we make has to be done between me, you if you were my patient, with your family members, and then additionally, if there's anything else that needs to be done, you have to talk to the other doctors, maybe the cardiac surgeons, maybe I have to talk to the electrophysiologist, the interventional cardiologist. And on top of that, you have to really work well with your staff members, the ultrasound technicians, cath lab technicians, all your nurses. So it's really a huge team-based approach, and I feel like there's a big rotating thing just revolves around the patient.
That's really cool. Yeah. It's kind of it takes a village mentality, but in your healthcare, which is pretty incredible too. I mean, if a patient can feel that and feel like, hey, 360, I'm taken care of in every direction. I mean, that's a really great, secure feeling that you can provide for a patient.
Yeah, and then the other amazing thing is just how much technology has really developed in the last 10 years or so, and all these transcatheter approaches to valve placements, different sequences for the MRI machines that we use. So and for better prognostication, for diagnostic information. So a lot of that, it's really amazing to be a part of and to apply to patient care.
That's fantastic. Tell me a little bit about your family. What background did you come from? What's your upbringing look like? Tell me a little bit about that.
Sure. My current family, I have 2 beautiful baby girls.
Congrats.
Zoe and
Amazing.
Olivia. And they're very baby, 5 months old and 20 months old.
Oh my gosh.
Yeah. And then my husband, he's in vascular surgery. So we
Okay.
met in medical school, actually.
Oh, really? That's cool.
And
Wow.
yeah, he's in we have some overlap in our specialties, actually.
Got it.
I text him I'd be like,
I was just going to say, you guys talk about work a lot.
yeah.
Can you help me? I'm going to give me some advice. I'll give you some advice.
Yeah, sometimes. And then, I grew up in New York, in Long Island, and I had an older brother who's also in medicine. Yes. And then
It runs in your family.
yeah, but my parents immigrated to the United States from South Korea. They came because they wanted a better education for me and my brother, better opportunities, sort of that American dream sort of mentality. And through all of that, they worked hard, worked blue-collar jobs, and they really helped support us to be where we are, and not only financially, but they showed us good values, hardworking, stick to your studies, be good people in general. So they really are at the core of who I am today.
That's fantastic.
Yeah.
And that being a first-generation kid, how do you think that your kind of upbringing was a little different, or do you feel like it was really similar to the average multi-generational American?
I would say there's some similarities, some differences, mostly similarities, because there are probably tons of first-generation children growing up in the United States.
Yeah, of course.
And especially being in New York, it's quite close to Queens, New York City, all
There's
of
a
that.
lot of great people coming in.
Melting pot of America.
Yes, exactly.
Yeah, so fortunately I was able to see other people, especially through church,
Great.
Other people who are sort of having a similar upbringing as I am. And I wouldn't say my story is entirely unique, but I am unique.
I was going to say, you are, yeah. And I think it's always interesting to me. I don't know what generation I am here in this country, but our August episode, Ixel, was another person who came in as a first generation. I think she is... I'm not even going to try to remember her nationality off the top of my head, but she's first generation here. So it was interesting learning kind of her background, similar reasoning for her parents to bring her here or to have her here and to move here. But I think some of their struggles to do so and to build that better family life definitely influenced her upbringing a little bit. And you could see that in her talking about, her mother was just a little bit more strict and they didn't go to parties and they had to be home super early, and everyone's like, it's Friday, you have to be home at 7? What the heck? And she's like, that's what my mom said. And I think it's fun for me to learn about the differences in cultures that come to America from everywhere, of that melting pot idea. I want to learn, and I love that idea. I think that's fantastic. And as your parents, this is fresh in my mind. I was just watching a movie the other day where the mom is always like, you're going to be a doctor. Just now, you and your brother are both doctors. Were your parents like, you guys should be doctors? Or was that really what you wanted? They never put that pressure on me per se, but my brother, they had different expectations for. He's like firstborn son of an Asian household, so there's a different set of expectation for him. I mean, I've always looked up to him growing up. Fantastic, right?
Yeah, I think maybe in 7th grade I said he was my role model.
Oh,
he
that's
still
cool.
is.
That's
absolutely.
good. Yeah.
So he's 2 years older than me, and he got into a medical school program first, graduating high school, and I've always looked up to him, so I wanted to do what he wanted. And then the other thing is, when I was in high school, my church did medical mission trips to Argentina.
Oh, amazing.
Yeah, what an incredible experience.
I can only imagine. How many times did you do that?
Twice.
That's amazing.
Yeah, I'm so blessed to have done that. And it was such an eye-opening experience, It was the majority of the portion was spent in the slums of Buenos Aires.
Wow.
And as a high school student, most of my role was to entertain the children, do the dances, the arts and crafts, but I also helped out a little with more of the, there was an ophthalmologist there was also an internist, so
wow.
I wanted to do what they did as well.
Yeah. So between probably your brother's future, kind of as he moved into the medical world, and those kind of maybe summers spent in Argentina, that's probably the two that built your kind of cardiologist future.
Yep, absolutely. And then the third portion is my mom actually got sick when I was in high school with breast cancer. So, you know, becoming a doctor and sort of helping other people like her. I obviously didn't go into oncology, but
but you probably saw her need. Same thing,
right.
that care 360 from every angle of her life, especially in such a need, and probably want to help then provide that for others.
Yes, yep.
Yeah, and did she have a doctor, or did you work with a doctor when she was sick that just stuck with you, that was really impactful?
Her doctor was so impactful. She really took care of her, made phone calls around the Queens, New York City area so that she could find the breast surgeon that she needed. To this day, she still says, you know, normally Dr. Sung does not take patients with my insurance. But Dr. Kyung made that phone call, you know, and I am here today because of all of my doctors.
That's really fantastic. So then full circle, you become one. It's gotta be pretty darn good, right? Are your parents just over the moon proud of you guys?
They're definitely proud of us, yes.
Yeah, that's really fantastic. My family's not two doctors, so we're a little different. That's okay. I think my parents are still proud, but it's fine. That's really impressive. Tell me, you mentioned your mom, so maybe she's the answer, or maybe you have several answers. Who are some women along your journey that impacted you? Who really hit home for you?
Well, absolutely, my mom. She's definitely more sort of the matriarch of the family. She's the glue that holds us together.
Good.
And then just throughout the course of my career, starting in residency, I had a Dr. Michelle Bloom back at Stony Brook, who was a great mentor. My senior resident, Corinne Hamo, she's also, well, it's in residency, so they're all doctors, but she really helped me develop any sort of research. We did actually research on cardio-oncology, which is cardiology and oncology, where they overlap. And then when I was in fellowship, I trained at Rush University.
Fantastic.
And our program director was female. My clinic attending and my mentor was also female, Dr. Melissa Tracy. And Dr. Rao, Anupama Rao, she did a lot of that cardiac imaging, and really it was her passion for cardiac CTs, cardiac MRIs that really sort of invited me to become an advanced imaging specialist in cardiology.
Wow, incredible. So you do have quite a few.
Yeah, I'm very fortunate.
Yeah, that's really amazing.
And Dr. Volkman, Annabelle Volkman, she is so wonderful. She really takes care of all the residents and the fellows, and she would take us out and she would have us all over. One time we had an all-female cardiology team, and then afterwards she invited us all over to eat, to socialize, to get to know each other.
That's really great.
Yeah, and she took us to a ballet. I mean, she's wonderful. So at Rush, it was amazing. And then even during Loyola, my advanced imaging training, there's always great mentors. I mean, Dr. Sanagala was through Veni Sanagala. I mean, we also would go out and break bread, because in medicine, it's but it's definitely hierarchical. You know, if you're a medical student, you're a medical school. If you're a resident, you're a resident. If you're a fellow, you're a fellow. And if you're an attending, well. Okay. Yeah, but it was really great and really warm and inviting for the attendees, to my eyes at least. That's at that time, to be like, hey, let's have dinner together. Hey, let's do this together. So those sort of experiences really stay with you.
And it seems so fun because you think about Grey's Anatomy you mentioned earlier, or like Scrubs, and you're like, it sounds really scary. And like you just get stepped on until you actually make it as a doctor, and everyone hates you until you do. And so to see that kind of the fellowship that happens prior to that and within those ranks, that's really impressive and a really cool, it might kind of reinvigorate somebody's medical future if they knew So maybe it's really not like Scrubs, and not everyone gets yelled at. For
there's definitely Scrubs moments, to be honest. Yes.
It's like, don't say that it's actually just like Scrubs.
Yeah. But it's and going back to what I said initially, what was surprising is, you develop friendships with not just your co-residents and co-fellows, but also with some of the nurses that you work with and the techs and everyone. So it's not just, like I'm going to be friends with like the 2 other fellows that I'm in fellowship with. You get to know everybody. And I think that's a really special time, because not only are you learning more about your coworker, I think that also leads to better care for the patients because you know them better.
And you can communicate well with them because you know them better. And then that whole thing happens better and you're happier. Right. At the end of the day, if you like where you're at and you like the people that you're doing things with, you're going to be happier and you're going to work better.
Exactly.
And we do that here all the time. I always want to hire people. I can love a person. They can be a great fit for the job, but if they're not a great fit for the company, then it doesn't work. Right. And that's why. Because if I put someone with these guys upstairs, we're kind of an open floor plan. If someone sits there and nobody in the room gets along with that one person, it's going to be obvious and loud. And you never want to do that. But I don't want to do that for either person. And I want to provide a team for these guys that they can take and run with and not have to worry about that stuff. Yeah, that's really incredible.
That's definitely a new word I learned, a good fit.
A good fit, yeah. And it means so much.
Yes.
Do you have any patient stories? Obviously, we can't talk names and specifics, but is there a patient through your time, and I think you said 8 years, that really sticks with you?
Yeah, definitely. I have a patient who I saw in the hospital, came in with heart failure. She was had just had her baby, actually. And then there's a case called peripartum cardiomyopathy. And it's when you develop heart failure around the time of your pregnancy and birth. And it could, you're at risk even up to 6 weeks post-birth.
Really?
Yeah. And in women who've been pregnant more frequently are at a little bit of a higher risk. So there are certain risk factors, but in the end, she developed peripartum cardiomyopathy. And so there's a few problems with it. Not only do you have heart failure, but the sort of medicines that we need to treat you with is limited if you choose to be breastfeeding.
Got it. So then that kind of takes a whole nother spin of difficulty on the situation.
Exactly. But fortunately in her, she said, hey, I'm okay with just not breastfeeding.
Let's move to formula so I can get fixed.
Right. I need to be alive to take care of the baby.
Yeah, exactly.
And so this is during fellowship, but we followed her case in clinic, and then her heart. So the nice thing about peripartum is your heart can recover. Yeah. So her heart recovered, and then she literally gave me a hug in clinic when the last time I saw her, and she was like, "Thank you so much." And it's cases like that that really warm your heart.
Yeah, because that person at some point was probably legitimately scared for their life.
She couldn't breathe. Yeah.
Like that is very scary, and it's probably tough to kind of. You're daily diving into some of those situations where maybe Wednesday is a great day and you have no one that's having cardiac issues, but. If Thursday you have 3, that's a lot of wear and tear on you to just see so many patients in kind of a distressed situation.
Yeah, it can get taxing to the soul.
And what do you do, or maybe what advice could you give to any other folks at that kind of tax situation? You talked earlier about that being a thing for cardiac arrest. Is one of those issues could be, it doesn't have to be me running down the road. It could be me stressed at work. I'm not running anywhere, but that stress could still cause heart issues. What help us learn about how to get out of that?
Yeah, so what I do is I tend to just slow down. And it's easier said than done for a lot of people, especially if you have children. Now I'm learning.
You got to kind of breathe. Like you said, can't breastfeed if you're in the hospital or not
Right.
here. So everything that you do is for those babies,
Right.
even when it's for you.
And then exactly at the same time, it's important to remember that you need to be healthy in order for you to take care of other people.
Yeah.
So it's really, you got to change the mindset of you yourself. You need care. And yes, it's a little cliche, you know, like self-care, self-love.
I know, but it's so true.
Yeah.
I think you're exactly right. Like we've said it so many times and we're like, self-care, let's take a bath. And you're like, no, self-care, like don't have a heart attack.
Yeah.
Like relax
For
and you have to
sure.
breathe and you have to, yeah.
And so if you can take time for yourself, maybe just doing maybe physical activity is very important. If you're able to work out or even go for a nice little walk, at least 30 minutes a day, 5 days a week, and do something that is going to relax you. Listen to a podcast, listen to an audiobook, listen to some music, listen to nature.
Yes, just the sounds of outside. Yeah.
And then, and if 30 minutes a day, 5 days a week, running around outside, especially in the winter time, is a little tough, then maybe during that 30 minutes, just open up an app, maybe a mindfulness app, a yoga app. There's a lot of free online content out there that you can utilize. Yoga, a big benefit of yoga is all the deep breathing exercises. And really carve out a time for yourself and put it into your schedule. Don't say, hey, I'm just going to do it after school. Like
because then that happens and you're tired. Or you
Right.
leave work and you pick up the kids and you've got to make dinner and 10 other things happen.
Right, but if it's in the schedule being like, oh, I have a podcast interview at 2 o'clock, sort of like that, but also, oh, I have a yoga class at 2 o'clock, or I have,
And setting, it allows you to tell people no as well. I think that's something that all women can do more of is tell people no.
Yeah, women tend to over juggle.
Yeah, and it's really hard. I struggle with that, whether it's, you know, this job, we always joke, but it gives you FOMO. Like there are so many cool things we get to learn about here because it's part of our job, whether we're covering the event or we're publishing the event, where we want to really like go to everything and you just got to say no. Or here, like if people schedule too many meetings for me, I'm like, reschedule one. I can't do 5 a day.
Right.
And I think you're right. It's really hard to do that because even me, I will definitely regularly say, I'll just do it.
Yeah.
And you're right. We kind of over juggle, over commit a little bit. And sometimes you got to take care of yourself first and say no.
Yep. And even with your schedule, you'd be like, hey, my kid's daycare ends at 3:30. I need to get out by 3. You know, you set boundaries and sort of stick to them. And you know, you're a boss yourself, but you surround yourself with a team that can work together, who understands your priorities, who understand that you are not just a worker here, but that you're also a mother, a daughter, maybe a Pilates instructor.
Right. We all have other things. Exactly. And that's the biggest part is we all leave here, whatever time it is, and we all have a whole life outside of here.
Right.
And that we all have to take some of that into account. You can't always be on, whether it's here or at home or all of those things.
Yeah.
Got to tell the husband no occasionally. Got to tell the job no on
Got to
some
tell
hours.
your children no.
Yeah. Probably one of the harder ones I would assume for most parents. They're like, yeah, I don't really want to do that, but I will.
Yeah.
Especially when you've got little ones. Like they're so little until they're so cute that you just can't tell them no.
Yeah.
Tell me a little bit about when you began your career, and then when you began your career, did you think that it would be where it is today? What it is, where it is, all those things, or how different is it?
So I started off my journey into medicine when I was a teenager. So
like you really knew before you were out of high school, like doctor it is.
Yeah.
Bro's doing doctor, I'm doing it too.
And once I got into medicine, and 4 years later, once you start medical school, the world of medicine was so much bigger and more complex than I ever imagined. And it's thrilling, but it's also scary a little at the same time.
There's so much involved in each, kind of individual aspect of it.
And then, even when I mentioned that I went to internal medicine because I liked everything, and even during residency, I loved cardiology, but I also loved everything else. So,
kind of ending on that cardiology side is a bit probably surprising for you?
Not surprising, but the path that I think a lot of it is the people that you meet, the people who really mentor you, who bring you into where you are. And when I wouldn't have expected to go into cardiology, but each step of the way at that time, it felt right for me.
That's great.
And when I was in Stony Brook, I had a lot of heart failure attendings really mentor me. Not just Dr. Bloom, but there was Javed Butler and Hal Skopicki, and both of them are really big names in heart failure. And Dr. Butler was in Stony Brook at that time when I was there. We happened to overlap a few years together, and he's a huge name in heart. He's on the guidelines and whatnot, and both my friend and I to this day talk about how lucky we were to be at the right place at the right time.
That's amazing, and it's cool to hear, like, really you absorbed all this information for all these kind of really impactful doctors along the way, and that's probably how you got on that journey.
Yeah.
I wouldn't have guessed that, but that's really impressive. And you talked a couple times, you mentioned a couple different mentors that you've had. I think that's something that maybe women struggle with a little bit these days. What would be your advice on, I would assume at no point did you say, hello, would you be my mentor? You know what I mean?
Yes.
Nor did they say, I would like to mentor you.
Yeah.
How do you, in those situations, how does one find a mentor? Or did that happen very naturally for you? Give me a little advice on that for other people.
For sure. I mean, for me, I was fortunate in that my clinic mentor, Dr. Tracy, she was set up with me.
Okay.
So in that essence, we developed a relationship together, and it blossomed because you have the same clinic mentor for 3 years.
So like really that was set up that way and it worked
Yes.
really well. And do you think that some people have a mentor that's set with them that does not make the impact that she made for you? Probably, I would assume.
For sure. I think every relationship is different.
This just really worked for you.
Yeah. And I think that no matter who you come across, you're going to take away something. You're going to give, obviously, to the relationship, but you're also going to take something away from the relationship. And it may not be what you expect to take away. So be open to what sort of learning points that you get from that relationship. So whether it be learning about the fine details of, how to read an echocardiogram, but it could also be something unexpected, like a secret shopping tip that nobody else knows.
Yeah, or even like bedside manner, or something that you wouldn't expect to learn in some of those scenarios that you would. And like it could be something not at all medical related, but something that could really impact you later.
And I appreciate your question, because going into medicine, starting off in residency, I worried so much about how am I going to find a mentor? Like, who's going to like me? How am I going to get along?
Help me? Yeah.
It's very daunting, and it's, but it's also sort of a part of me just had to be like, all right, just go for it, just take that next step.
Sometimes it's got to be a little bit of a leap.
Yeah, and then once you get into that relationship, you need to work hard. You need to put into the relationship what you hope to get out of the relationship.
Okay.
And some of the mentoring in academic medicine is doing research. So if you want to be successful in research, you have to read the articles, come up with a plan. You have to do that work. And you develop a relationship by spending time together, and whether it be in clinical work, outside of work, or doing the research. And I think a lot of people think about what sort of mentorship relationship that you want, and you have to decide that for yourself. Is it going to be a research relationship? Is it going to be a work relationship? Like, what do you want from this mentorship?
That's really smart. Almost knowing like this is where I need to make this work, and this is where I need to put my effort in and my energy in, and it's going to help me the most.
It's like any relationship, if you have a girlfriend, and then you just, I'm not saying every relationship should be like give and take, but usually,
it should be something similar to that.
And you're sharing responsibilities and whatnot, and usually if you are committed and you're into it, the other party is usually about the same.
Yep, I completely agree. Usually you'll get what you give. Most often that kind of, it evens out over time.
It does even out.
Tell me about some significant adversity or obstacles that kind of you've had to overcome along your way, along your journey. What's been tough for you?
I would say one of the toughest thing I had to go through was being in a long distance relationship with my husband.
Okay,
Yeah.
that's tough.
Yeah.
So you guys met in medical school.
Yeah.
And then
We
separated? Went different ways?
Yeah. So in medical school, there's something called a match process. And it's sort of like a lottery. You interview at a bunch of different residency programs. He went into general surgery. I went into internal medicine. And then I'm from New York, and there's a bunch of programs in the New York City area. But on match day, there's an algorithm. You rank in order of the programs that you want to go to, and then the programs will also rank in order of the candidates they want to come.
Okay.
And on match day, so it's so dramatic.
It sounds very dramatic. I'm very concerned to talk about it. I'm like, oh my gosh, tell me more, as I get nervous to hear about it.
On match day, on Monday, you find out, hey, congratulations, you matched somewhere. And then later in the week,
Like the one you wanted also wants you?
it
match?
tells you matched somewhere, meaning you don't know where you're going yet.
But someone would like you.
Yes.
Okay,
yes.
wow.
Someone at one of the programs you ranked wants you as well. So it's, and then
It's a little bit nerve-wracking.
yeah, and then so you're so excited. You're like, yeah, I'm gonna be like a doctor or an internist or whatever.
Someone chose me.
Yeah. And then match day comes and there's a whole party, and then your advisor gives out little envelopes of.
I feel like I'm on like a dating show.
It really
Yeah,
is.
like I'm getting a rose. I get to stay.
And then you open the envelope, and then that's when you find out where you matched.
Okay.
Yeah, so we opened our envelopes, and it's still surreal. We matched to like the most East Coast and the most Midwestern program you could ever go to.
Really?
Yeah, the farthest East and the farthest West programs, and I was like, oh my
And did you guys just
gosh.
look at each other like, uh-oh?
I mean, there were tears. It was
Really?
Yeah.
Oh, like you're
yeah.
so, and by that point, had you guys been dating for quite some time?
Yeah, we started dating second year, so at least 2 years.
Okay, so you're a
yeah.
couple years into it.
Yeah.
Hoping like, let's just make it close.
Yeah.
And then
it didn't work out the way we wanted to. So it was, so I was in Long Island, so I would drive an hour to the airport and then fly 2.5 to 3 hours to St. Louis. He would pick me up in St. Louis, and we'd drive another hour and a half back to Springfield. He was in SIU, Southern
my
Illinois
gosh.
University. So we did that for 3 years, and then because he was in
for
SIU,
3 years. And so probably just weekends.
just weekends, but not
Probably
every
not even,
weekend.
I was just going to say, and not, there's no way you can do
started
every weekend.
about once a month, I would
Okay.
say. Thank God for FaceTime, right?
I know.
Yeah.
20 years ago, this would have been a lot harder.
Yeah. And then
Wow.
that's why I went to Rush to Chicago to be closer. So we went from a long distance to a short distance relationship.
You're like, there's still plenty of distance, but it's just not as bad.
It's definitely easier. And then he matched to Loyola for his vascular fellowship.
Great.
Yeah, so that's when we finally lived in the same city. And during those years, we got married.
Really?
Yeah.
You got married while you guys were living in different parts of the country?
Yeah.
Wow.
But I had lived in Chicago for a year at that point.
Okay, so you're both in Illinois, but still probably a couple hours, I would assume, Springfield
3.5
to Chicago.
hours
Okay.
south, yeah.
Wow, you got married living 4 hours almost apart. That's
I know.
really incredible.
It's nuts. And what's even crazier is this sort of thing is not uncommon in medicine.
Really?
Yeah.
So kind of people meet and then like probably oftentimes meet,
Yeah.
start dating, get ripped apart, and then but still manage to make that work?
Yeah.
Really?
Yeah.
That's got to be, I was going to say, not only is that some tough times, but
Right.
also just match day alone is some struggles. That's sounds so stressful. Wow. It's like an annual like job interview. Either you're going to get picked or not. We'll see.
Oh my gosh.
And everyone's going to know.
Everyone knows.
Yeah, like everyone in that room knows who's happy and who's not, right?
Yeah, and then there was a TV crew from like the local Albany news. Oh my
They're like, it's
God.
match day, everyone. And it's like, what? That is really intense.
It really
And then
is.
were you guys nervous saying, okay, technically, you probably hadn't lived together. Had you lived together prior to getting kind of separated on match day?
No, I mean
You're dating,
Albany's a
but not-
small town, but we were dating, and then we're just like, oh.
And were you nervous getting married? Like, technically, we've not really lived together. Or you just knew?
I I think we knew. I think one of the plus sides of long distance is it really makes you communicate in a way verbally, like more so than the nonverbal communications.
Because you can't get the nonverbal as easily because you're not seeing you're not getting my vibe when I'm standing next to you. If I'm mad, you know. But if it's Zoom, it's harder to see that stuff.
And at that point, after 3 years, we were like, well, if we could do this, I'm sure we could spend the rest of our lives together.
Literally, we barely got to see each other, and I still like you. So,
so I guess it'll be all right.
How intense. That's really incredible.
Yeah.
That's a really great one to mention because I don't know that I could do that. Really good. Yeah, I'm proud of you guys.
Oh,
and now 2 kids later, it's obviously working, so you did well.
Yep.
And you're both still in medicine, so you must love it. That's really great. Kudos.
Thank you.
Work-life relationship. So doctors, I feel like, are the ones that we are always like, well, it's not like you're a doctor or something. So it's kind of almost like the field we put on blast for working so much and kind of being always working and always on and tons of hours, and probably every TV show you watch talks about that doctor that just has, on calls all the time and is always working. What does that look like for you? Are you that person? Are you a little bit more, hey, I really separate my work and my life, or do you really try to balance differently? Are you always on as a person? How does that work for you?
I would say I try to maintain a balance. It's easier said than done.
I bet.
For sure. So our practice runs in that the non-invasive group does 1 week of inpatient at a time, and those weeks are when you're on, you're on. You go in 7 a.m., get out when you're done with your day. So it can go anywhere from 7 to 6, 7 to 7, which can be a long day. And I'm told that it's because I'm new and I just need to work through my system.
Okay.
Which I'm fingers crossed.
Okay.
Fingers crossed. And then the outpatient days, it's a little more control because there's a set number of slots for the patients that can come in. And then we also do diagnostic testing. For example, this morning I supervise all the stress tests and whatnot. And I have an MRI and a CT reading time period. So I try to make it more balanced, but oftentimes I'm not going to lie, I do end up bringing some work home. Yeah. I do some of the readings at home, and that's a compromise that I have made for myself. Like if I choose to go home in time to spend some time with my kids, that means that once they're in bed, I may end up reading a few more studies, EKGs, echoes, whatnot. Given that statement, I am trying to be more efficient with my work day.
Kind of trying to get as much as you can done. That's one of my struggles too. I think when in my world, I'm managing people, and I think that's one of the most important jobs I can do, is make sure all of my partners are really happy and all of my team is very happy. But sometimes that takes your whole day.
Right.
And then you go home and you're like, okay, so I had a bunch of stuff to do. And I didn't do any of it.
Yeah.
It was a great day, but I didn't do any of it.
Right.
And that sometimes I'm the same where, okay, well, I'll take this video and I'll review that at home, and I'll review that at home, and I'll read this at home. But the people are happy, and that makes me happy, and we're all better off that way. But it's tough. Yeah. You're right. And I like that you said, like, that's my balance. Like, that's, I am going to give up to where I leave early so I can go put my kids to bed and be there for the rest of their evening. And then I'm going to get back on and do some things for me.
Yeah.
Or for the work.
Yeah.
What do you do for you?
Me?
What do you like to do? What do you do to relax? Do you run? Do you sleep? Do you listen to music loud and dance around your kitchen?
Yes.
She's like, how did you know that?
I do like to, take massages, facials for sure. Not too often, but they're definitely a treat if I do get them done.
That's a great one. Yeah, a massage is definitely like my little treat too. Yeah. I just love to just be like, I'm just gonna get one. Look at me go. And then I'm like, I talk about it. I'm like, I have a massage today.
Yeah.
Look at me, I'm so fancy. It's like, okay, you did that on your own, so it's not that deep.
Yeah.
But I just feel like it's a good treat for me.
Yeah.
Yeah, that's good.
Yeah, a little bit of pampering here and there. You get your nails done, toenails done, like in just an hour just for me. And then
that's a really good
I
idea.
am trying to do more exzing.
Okay, because you told me, so now you have to too.
Yeah, I really need to preach.
30 minutes, 5 days
when
a
I
week.
preach.
Yeah. That is something I think I've been telling folks. I try to do 45-minute walk every day.
Oh, great.
try to make it outside every day. I did a challenge that made me do that for 75 days, and I found that getting the steps, number one, it makes me like stare at my watch and be like, do you guys know how many steps I have? Which is annoying to everyone but me, and I love it. But also, the mental side of that, it really does make you like, and now here, my right hand Cammie, she'll literally come and be like, do you want to maybe take a walk before your next meeting? You've got plenty of time. And I'm like, you think I need that, don't you? And she's almost never wrong. So when she says that, I'm like, do I have time? She's like, yes, you have 1 hour. You can take 45 minutes. And I'm like,
oh, wow.
I appreciate you. And I just do it. Like, you have an hour till your meeting. Go take a 45-minute walk. Okay. And because if she's suggesting it, I know that I need it.
Right.
But it does. It helps. My body functions better.
Yeah.
Just less like aches and pains.
For sure.
The mental side of it for me is really the biggest benefit. I think you're right.
Yeah.
Like, if you can just get outside, get grounded, like literally stand on the grass with no shoes on.
Yeah.
For
Just
10
break.
minutes, just take a breather, and then just take a walk.
Yeah.
It's really beneficial. I think that's a really great advice for everyone.
Yeah. The old
from
term is stop and smell the roses.
Yeah. And it really means it. Like,
it does.
really be outside, and it's so, like, yesterday was a gorgeous day, and it's like, okay, I'm going to go walk right now because it's sunny, and it's like 75, and like, we live in Indiana, and we need to just hug every perfect weather day that we have because there's a lot of not perfect ones. And so that, I think, compared the mental benefits paired with the physical are bar none.
Definitely.
That's fantastic. Are you ready for some quick response questions?
Sure.
Anything that I haven't touched on outside of these wild questions that you're going to get that you think would be pertinent to the conversation? Anything that you wanted to kind of tell women that we haven't touched on already? I mean, check the heart. Make sure you're walking
Treat
every day.
yourself. Take care of yourself.
Yes. Okay, that's perfect recap. Okay, so first up, would you rather? And we explained this off recording. I will buzz you if these are not good. This is our speed round.
Sure.
Not fast enough is usually the buzz. Like I said, I did maybe buzz Ixel last month for her poor answer, but usually it's just speed.
Okay.
Would you rather go into the past and meet your ancestors or go into the future and meet your great-great-grandchildren?
Future.
Yeah?
Yeah.
You want to meet the grandkids? Mm-hmm. Okay. That means you're going to have them because you've got kids and now you're planning the future. Okay. Would you rather meet George Washington or the current president?
Current.
Current? Okay. That's the first current I've had. Everyone wants to meet George Washington for some reason.
Well, I would have a few words of advice.
Agree. What woman would you want to have on your side in a battle royale? So fight to the death.
Oh, which woman?
Yeah, any woman in the whole world. You know, you don't know.
Can I have like Wonder Woman? Mm-hmm. Yeah, I'll take Wonder Woman.
Wonder Woman it is. What an answer. Hello, everyone that answered this question before today. That was the best answer. Now, would you rather everyone in the world be smarter or nicer?
Nicer.
1,000,000% agree. What would be the title of your biography?
The Life Adventures of Stella Bobo.
You're so cute, Stella Bobo. Tell me more. You can't say that and not expect me to come right back to it. That was a lovely name. Is that your nickname?
That was a nickname I had during residency.
That is cute. And how can you tell how it came about? Do you even remember?
My Korean name is Bosun.
Okay, beautiful.
So Stella and Bosun, so Stella Bobo.
Oh my God, it's so cute. I love it so much. That's a really great title. You win. What is your favorite month of the year and why?
I like May because my birthday's in it, Mother's Day is in it, our wedding anniversary's in it.
Oh, okay.
Yeah.
Perfect. Yeah.
It's not my husband's favorite month.
Actually, I just call that the expensive one.
Yes.
That's a good month. And did you plan that, or is it obviously with your kiddos? You probably couldn't plan it, but did you guys get married close to your birthday on purpose, or it just happened?
No, I wanted to get married in the spring, and then I think it was Memorial Day weekend that we got married.
Perfect. Yeah, we got married Labor Day weekend, but it was the same reasoning. I was like, it's close to the holiday weekend.
Yeah.
It'll be easier for people. Yeah. It'll be great for us later because we usually will have a kind of
day off
anniversary
around
weekend.
then,
Yeah, exactly. What superpower would you most want if you could choose only one? You can fly, you can, I suppose, shoot spider webs out of your hand. I don't know.
Oh man, I would probably I want to be able to have everyone just be nicer, resolve conflict sort of thing.
Okay, that's communication. Yes.
Yes.
Conflict resolution. That's a really good one.
I mean, yeah.
I've learned.
You can tell I have 2 kids.
She's like, listen, you two. This is going to be a tough upcoming if you guys can't get along. Yeah, conflict resolution is a good one. I have learned probably just through managing people a couple years now, and that paired with, of course, family and siblings and all of those things. I don't have any kids, but I think conflict resolution is so important, and I often find if people say things like, my friend always says, words are good, let's talk. 90% of the time, if you just say the things, we're all like, oh, I didn't know that you felt that way. Oh, I guess I didn't realize that. Oh, and we all come, like, just saying the words, we're all like, oh, I get it now.
Yeah.
I might not even agree, but I get it.
Right.
And I think you're right. Like, let's just have the conversations and get it over with. Yeah, super smart. So we've now officially had someone on the podcast say that her superpower would be, what did Natalie say? It was something similar that was like, I would be kindness woman or something. And I was, so between the two of you, I'm very excited
We're making
about
the
this
world
group.
a better place.
You really are. You really are. Would you rather make a phone call or send a text?
It would depend on to whom.
Okay. Yep. I love phone calls because text is good and short, but phone calls can get a lot more done, I think.
Yes.
Like on the call in 5 minutes, I can accomplish probably everything I need to. And the text, it depends. I can't write it all out, so it's got to be 2 texts, and then I got to wait for you to text me back to send the next one, and it can get hairy. But
Yeah.
sometimes I don't want to, my mom's going to keep me on the phone for an hour, and I don't want to do that. So I gotta go. Love you, Mom. Talk to you later. Bye. Would you rather be a kid your whole life or an adult your whole life?
Oh. No, maybe probably adult.
Adult?
Yeah.
Okay. That's a good one. I don't know. I can't decide. I like being a kid. But I think,
I do too.
Yeah.
But think about, like, you wouldn't be able to go to Las Vegas.
I feel like we need to hang out. I think we can party.
Like, imagine wanting to go to Italy or something.
Yeah, then you're like, oh, well, I'm 7, so I can't.
You have a bigger world available for you.
That's a great point.
Yeah.
I have not heard that yet as feedback, but it's a great point. You do have a lot more world at your fingertips when you are young and just an adult versus when you're a little kid. Yeah. Because, they can't do anything. They definitely can't go to Italy.
No.
Well, that's it. You made it through. You didn't even get buzzed. Not one buzz. There you go. Well, thank you so much for joining us. You are a delight. Tell people, should they connect with you online? Do you want them to find you? Do you want them to call you and come visit you as a cardiologist? Sure. Tell us how you want people to follow up with you and connect with you.
I have a LinkedIn account.
Great.
So that's where my professional account is, and my office is at Northwest Health Porter. I have a clinic in Portage and at Porter Regional Hospital.
Fantastic.
So those are probably either in person or online. LinkedIn would be best. I think I have a Twitter account, but I don't use it often.
So really, hit you up on LinkedIn. Come to your places within Northwest Health. Yeah. If they want to learn more on their heart health and how you can help them. Yeah. Well, thank you so much. You are a gem. It's been exciting to learn more about you. To our listeners, please make sure to follow us, rate us on all of the podcast outlets, tell them that we're so fantastic, and we will catch you next month for another awesome episode of All About the Girls. Take care.
Thank you.